On Tuesday, we had our workshop on personal health knowledge graph. So what did we talk about at this workshop? Well, first of all, let me share what our goals were, right? Our primary goal was to talk about the potential for using personal health knowledge graphs to integrate social determinants of health and what some people would call observations of daily living into patient records, so that the patient record is not just about the electronic health record as we know it today, but also includes other aspects of people's lives that are important, in particular for engaging them in their own care and helping them to make lifestyle changes that we know can prevent costly health conditions down the road. Part of the challenge of doing this is that often you need insights to be both personalized and explainable. And so that was another goal of our workshop, to talk about how we can use knowledge graphs to make insights more personalized and explainable. So some examples of the questions that we considered: what makes a knowledge graph personal? How can it be used to support patient engagement and behavior change? What are the existing tools and techniques that we have available for supporting this? And what more is needed from our community? As some of you may have been able to see so far in the conference, we've had this wonderful, talented person, Thomas Pasma from Flatland, providing us with graphical summaries and illustrations of various discussions. And so I thought that it would be a good idea to pretty much use his illustrations to walk through the different portions of the day. I think the graphic is a bit large, so it takes a little time to advance.
Could you maximize your screen? So we have...
Well, okay. So the challenge I have, because when I'm working from home, I have only one screen. So
okay,
I have my speaker notes. So I know it's a bit of an eye chart.
No problem.
But yeah, okay. So in Rita's talk, she spoke to us about precision prevention, which is about assigning targeted interventions to distinct patient risk strata. And it calls for collecting and analyzing large amounts of data to capture behaviors, lifestyle, genetics, family history, and environmental context. And she used examples from her ongoing research in breast cancer prevention to illustrate that when the right combination of EHR data and, importantly, patient-generated health data are integrated into the clinical workflow, then these insights are likely to be more accepted by both patients and providers. So the key that she was really driving home is that just collecting the data without integrating it into the clinical workflow would have a limited impact on outcomes. And she also made the point that patients, not providers, in this vision of precision prevention, are the ones primarily responsible for capturing and recording their data and for directing the sharing and distribution of the data to key stakeholders. And this really helped us to set set the stage for the discussion that followed the rest of the day. We also had a series of lightning talks. Sola Shirai presented different perspectives on what makes a knowledge graph personal and how different people in the field have defined this and represented this. Nidhi Rastogi presented some of the design and implementation challenges related to personal health knowledge graphs. And Matthew Johnson described how semantic data dictionaries can be used to harmonize diverse data sets to populate a personal health knowledge graph. Then we had a first panel in the morning, and there were several nuggets of wisdom from the field. And by that, I mean, the healthcare delivery field. And some of these nuggets included that from Dr. Tina Paputsakis, who's from the Academy of Nutrition and Dietetics. She said that capturing the continuity of care really means paying attention to the deltas or the changes in the patient experience and outcome over time, rather than just looking at absolute numbers. And Dr. Jeff Rogers, whose expertise is in Internet of Things, pushed back a little bit when people brought up the idea of more standards, he said, let's figure out what works first, right? And he also had shared with us a lot about what the state of the art in IoT is and how it's being used in many situations beyond just wellness, but in many clinical applications. And our keynote speaker, Dr. Rita Kukavka, raised concerns on the panel about how the digital divide might be exacerbated as healthcare becomes increasingly digitized. In the afternoon, Dr. Jim Hendler gave our second keynote in the workshop, and he talked about enhancing precision wellness with personal health knowledge graphs. He described how a patient's information needs, in particular to support lifestyle choices that could prevent or manage the exacerbation of chronic disease, how those information needs are dependent on specific micro to macro level contexts, and that it would be important to be able to make relevant connections between very specific information about a patient with very general medical knowledge. He also talked about various challenges that are related to data integration and privacy, and how in personal healthcare applications, we could combine learning and reasoning to provide more personalized and explainable insights to patients. We had a second panel for the day, on this panel, there was a very lively discussion about how knowledge semantic technologies can be applied to personal health data and how those methods might be used to improve healthcare overall. Some of the major topics discussed include privacy, data sharing, how to provide appropriate access control to the data. And another prominent topic that was brought up was that it's really critical to provide context around the data so that physicians and patients can find the insights actionable. So all of this led into three breakout sessions. One was around, and these were topics that were decided by the audience, right, over the course of the day. So we had one breakout on technical infrastructure needed for supporting personal health knowledge graphs, another one around decision aids for shared decision making, and a third topic around privacy concerns. I see I don't have time to share the nuggets of wisdom from those breakouts, so I will leave it at that for now, because I do want to say something about the reaction that we got from people in this workshop. And there was an interest in keeping our community alive, that some of us didn't realize that there were more of us than we thought there were. And so we've started a Google group that at least for now, we'll use that to create a connection between us. If anyone who did not attend the workshop is interested in joining, feel free to contact us, and yeah, we would be happy to welcome you to our burgeoning community.